Another question says, I have an acute episode of cellulitis, but I also take prophylactic antibiotics. Do I stop them?
Ooh, yeah, okay. So, yeah, really you shouldn't take 2 lots of antibiotics. So for that acute stage, the general rule, and this is important because there's not, it's not a blanket thing, but the general rule is you stop your prophylactic antibiotics and you go on to antibiotics will treat that acute infection. Then you start back on your prophylactic when that acute infection is resolved. What is really a worry sometimes is that you don't finish that acute cycle and then you go on prophylactic and you haven't actually got rid of that acute infection. So a review by a prescriber at that point is really important. But yeah, the general rule is you start your acute antibiotics, then once that infection is resolved, you go back onto your prophylactic antibiotics. What we're trying to do in Wales is make sure that those patients who have had a few episodes of cellulitis have those acute antibiotics at home, and they can start those if they need them, when they need them. Because remember, you are the expert, so you know. So the education around that and making sure that it is a cellulitis is key. But once we know that you're really well informed and we have that discussion and we know that you know your condition really well, then actually giving you those tools to keep you well is really important.
Yeah. And who knows more about lymphedema than you?
Yeah.
You are the experts, not us. We can advise you and give you some information, but you live with lymphedema day in, day out.
Yeah.
So we learn from you. So it's really important that you tell us how you feel, how lymphedema impacts on your life, and what we can do as therapists to try and decrease that impact on your life.
I think an important part of that as well is we are involved in research, but we want that to be driven by the people who are affected by it. So please get in touch with either your local service or us and let us know what's important to you, and then we can build some audit research around that area, because the evidence out there is quite minimal really. And if we talk about garments, for example, wear your garments 8 hours a day, where did that come from? Who said to wear them 8 hours a day? There's limited research around things like that. So you are the key to this, to work with us so that we can build really good evidence that matters to people with a condition.